How does stroke commonly affect children?
Stroke can affect kids in a variety of different ways. I'm a physical therapist, and often we see kids who have hemiplegia or hemiparesis, which means they have different impaired motor skills. So they might not be able to move their affected side or affected sides like we normally would. Strokes can also affect kids with speech impairments, cognitive delays. It will affect their fine motor skills. A lot of kids who have strokes have a high rate of seizures. So it really can affect not only their physical and fine motor skills, but also a lot of global skills overall.
Okay. What kind of adaptations must stroke patients make?
Well, a goal is that we minimize adaptations, and as a physical therapist, if they have one side that they might not use as much as the other, we try to get them to use their affected side. So we try to limit as many adaptations, but we know that's not always possible. So adaptations might include gait trainers, which are similar to a walker that an older patient might use, but we call them gait trainers, and ours sometimes have more prompts so the kids can get some trunk stability or pelvic stability or arm stability for walking. Other adaptations might include seating systems, so a lot of our kids can't sit upright in a chair, so we have to find a medical chair basically that they can sit in that will provide them the head and trunk support that they require.
Okay. What are some basic long-term or short-term goals for a patient?
Some basic long-term and short-term goals. Those are completely based upon function of the patient. So you might see a patient who had a stroke, and to a person walking by, it might not look like they have any impairments. So a short-term goal and long-term goal will be completely different than the goals that a stroke patient who had severe brain damage. So a stroke can occur in minimal damage, or it can result in permanent long-term damage that the patient can't hold their head up, they can't swallow independently on their own, and they rely on feeding tubes, and they have breathing issues. So it's such a variety, so goals are completely based upon the patient's function at the time that we're seeing them. Our short-term goals we try and reach within 8-week intervals and then progress from there.
An overall time span, how long does it usually take for a normal patient to reach their goal?
Oh, and again, that's so patient dependent, but we reassess our goals every 8 weeks. So, because we don't want anybody to feel like they're involved in therapy forever, so we reassess our goals every 8 weeks. And if they're making progress toward more age-appropriate skills, that's great. We tend to stop therapy when a plateau is reached, and so oftentimes a patient will transition in and out therapy throughout their lifetime. So every 8 weeks is typically when we reassess our goals and come up with a new plan moving forward.
What are common exercises or activities that are used during rehab?
So a lot of times patients with stroke have a lot of extensor tone and extensor thrusting. So if you sit them in a chair, they tend to lean back a lot. Or for kids, we often work on crawling. So you put them in a quadruped position, which is a 4-point position, and they automatically lunge forward. So we work on a lot of flexion positions and flexion postures to break up some of that tone. We also do a lot of positions in midline. So a lot of times, for example, a child might not use one affected side. So we work on having them bring their hands to midline. Or as a progression from that, we'll work on crossing midline. So that's a little bit higher level. So those are some of the treatment activities that we focus on. And then we move to hopefully higher level balance skills, whether that's higher level in sitting, 4-point, or standing as well. So,
how important is a rehab for stroke patients?
It's very important. So the key is to get kids in as soon as possible for treatment. So the treatment should begin as soon as possible, and there's great evidence that supports you make a ton of progress within the first 2 years of your life. So there's a lot of neuroplasticity that can occur during that time frame. So you might always hear the term early intervention is key, and that really is very truthful because you make a ton of progress within the first 2 years, because as a child your brain is so plastic that you can make a lot of new connections with your neurons.
Thank you very much.